Title: Understanding Stroke, the Silent Threat Linked to Hypertension. Learn the causes, warning signs, and how to prevent stroke before it strikes. Introduction. This is me welcoming you back to my channel. Hello my amazing friends. Welcome back to Your Health, Your Wealth, where we share simple, practical, and life-changing health tips to keep you strong, informed, and in control of your health. Today, we are talking about something very serious but also very preventable: stroke, one of the most common and dangerous complications of hypertension, also known as high blood pressure. Let's dive in and understand what stroke really is, what causes it, how to recognize it early, and how you can protect yourself or your loved ones. What is a stroke? A stroke happens when the blood supply to part of the brain is suddenly interrupted, either because a blood vessel is blocked or burst. Remember, your brain needs a steady flow of blood to get oxygen and nutrients. When that flow stops, even for a few minutes, brain cells begin to die, leading to serious damage, disability, or even death if not treated quickly. That's why stroke is often called a brain attack. Just like a heart attack affects the heart, a stroke affects the brain. Types of stroke. There are two major types of stroke. Ischemic stroke. This is the most common type, about 85% of cases. It happens when a blood clot or fatty deposit blocks an artery supplying blood to the brain. Hemorrhagic stroke. This occurs when a blood vessel in the brain bursts, causing bleeding into or around the brain. This bleeding puts pressure on brain cells and damages them. There's also something called a transient ischemic attack, TIA, or mini stroke, which causes temporary symptoms that go away in minutes or hours. But don't ignore it. A TIA is a warning sign that a major stroke could happen soon if preventive steps aren't taken. Major causes and risk factors. Uncontrolled hypertension and high blood pressure. This is the leading cause of stroke worldwide. When blood pressure remains high over time, it damages and weakens the blood vessels in the brain, making them more likely to rupture or become blocked. Smoking, nicotine and carbon monoxide damage blood vessels and increase clot formation. Diabetes, high sugar levels damage blood vessel walls, increasing the risk of blockage. High cholesterol causes fatty deposits in arteries, reducing blood flow. Obesity and physical inactivity, these increase the risk of hypertension, diabetes, and high cholesterol. Excessive alcohol intake raises blood pressure and weakens blood vessels. Family history and age, the risk increases with age, but strokes can happen even in young people if lifestyle factors are unhealthy. Stay tuned as I bring you part 2 of the topic stroke. Don't go away.